Now, the Omicron variant is causing quite a spike in hospitalizations, especially in children younger than 5. The variant is the most transmissible so far. So let's find out how hospitals are currently coping during this fourth wave. Joining us right now, the acting Deputy DG for Primary Health Care, Mr. Ramphelane Morewane. Thank you so much for your time and good morning to you. Let's talk about those hospital admissions so far. What is the data telling you about the average patient? Are they vaccinated? Are they not? Also, how old are they and are they in hospital due to COVID-19?
Dumelo, thank you very much for having me and good morning to the viewers of eNCA at home. The picture that we see indeed is the one of an increase in the admissions, particularly for the younger children. So it's a different phenomenon that, compared to the previous 3 waves. But you see, the increase in the number of cases has not come as a surprise to us, because I must say, we knew it was going to come. That is why we spent a lot of time planning for the 4th wave. So it's just that, as I say, the pattern changed, that the younger children are being admitted. With regard to whether they have been vaccinated or not been vaccinated, I think it's a combination. It's a combination of those that have been vaccinated and those that have not been vaccinated. It's a combination of those that are new infections and those that are reinfections, particularly in the older group that had always been vaccinated. So it really varies. But there's work going on to really try to dig deeper into the split, so that we can definitely know 50-50 or 45-65, 45, 55.
Right.
But as things stand, we can tell you that the severity of the infections and the disease for those that have been vaccinated has shown to be much lower than for those that have not been vaccinated. So this is the report that we're getting from the hospitals. So that's for sure that we can tell you. But in terms of the split, I think the work is going on. Because remember, it's almost like a moving target, because you can't really have a target and say you'll see 5 or so admitted.
Right.
So as they go in and doctors are able to disaggregate, they'll then be able to tell exactly in terms of the split. But I can tell you now, vaccination, non-vaccination, nobody is spared. People get infected. Some are getting reinfected. So which means the first infection does not trigger immunity. So when you get infected, it does not mean that you will never get infected again.
Right.
So we also see the reinfections in that area.
So with that being said, and the numbers that you're sharing with us today, Dr. Morewane, of those numbers in terms of hospital admissions, how many are in ICU? Are you concerned about the number of ICU patients currently at hospitals at this stage?
Currently, our breakdown is that as of yesterday, 81% of our patients are lying in the general wards. And I think it's about 9.1% that lies in the high care, critical care areas, just so to say, critical care, meaning high care and ICU. But that number has grown slightly compared to the time before the 4th wave. But of course, it's not uncharacteristic of this time of admissions, but it hasn't gone as high as we would have expected. But in terms of bed occupancy, it has grown to that number. But it's a number that, as I'm saying, I don't want to say it's expected, but I'm just saying, during this time of COVID-19 infections, you see many people in ICU. But I think the beauty of it is that the general admissions, relative to the previous waves, have not been going very, very far and very fast. So we're watching the space and we're not leaving anything to chance at this time.
Right. Let's talk then about bed capacity, because that seems to be a call for concern, particularly for this 4th wave. We know there's so much more that is yet to be understood about the Omicron variant. We know that it's highly transmissible. We know that it's got at least up to 10 mutations, highly transmissible compared to other variants. So when we look at the numbers in terms of new cases and infection rates and bed capacity, are you prepared as the health department to accommodate anyone that may need a bed in hospital at this point?
Yeah, as I said, when we exceeded the third wave, we went into a deliberate planning sessions, various sessions, to plan for the fourth wave. We have what we call resurgence plans. Provinces have resurgence plans, and in the resurgence plans, we identified critical areas that needed to be addressed, and chief among them is the number of beds. So we have adequate beds to admit patients, and we have increased number of beds that have got access to reticulated oxygen. We have got a good supply of respiratory support devices that people generally call ventilators. So in that space, we think we are okay. But, you can never take anything, for granted, because, this pandemic has shown that it changes every time, every wave differs from the other. So
we seem to have lost you there, Mr. Ramphelane, but definitely point taken there. The Health Department's Ramphelane Morewane is talking to us this morning about bed capacity, but also about the number of those in hospitals, saying that only 81% of those in hospitals are part of the general admissions. So that number seems to be less in ICUs. However, saying they take nothing for granted because it is a moving target, and with this Omicron variant, they continue to study exactly, how it works compared to other variants.